Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. And today, I'm joined by Jae Walker, patient advocate. In our Creaky Joints community, we've been connected for a couple of years, and I'm excited to catch up with them about their diagnoses since I've known them, but also just hearing how their journey started with rheumatoid arthritis years ago and ultimately what advice they have for patients. So, Jae, welcome to the Health Advocates.
Oh, thank you. I'm so excited to talk to you again. It's been so long, too long.
I know I still have your artwork, got 2 pieces from you, and I still have them both hanging in my apartment. So, while we may not have talked in a while, I'm thinking about you all the time.
Oh, I'm so excited. And I actually just thought about you the other day because I had another patient purchased one of my most recent pieces that I did for Creaky Joints when I did that blog called The Darkness of Pain.
That's awesome. Well, yeah, why don't you introduce yourself to our listeners? Tell us a little bit about you and your story.
Okay, so my name is Jae Walker, and I feel like I'm kind of like your average everyday person, except when I was 34, I first started showing symptoms of rheumatoid arthritis, except for it didn't come on slowly for me. I felt I kind of got run over with it. I went from nothing to all of a sudden I was working for a local grocery store. I was working in the dairy department, and I was pulling 1,000-pound dairy pallets on my knees in the dairy department, stocking the milk and the butter and doing work that a lot of the guys and stuff wouldn't do. And I'm actually non-binary. At the time, I identified as female. So I was doing a lot of stuff that the guys wouldn't do. So I was on my knees and knee pads, like throwing all this product and everything. And then all of a sudden, I was in so much pain that I started drinking wine at night in order to even go to sleep because the pain was so bad, which is a really big deal for me because addiction and alcoholism runs in my family. And I was in so much pain that I would wait until the absolute last minute to go to the bathroom because squatting to sit down on the toilet was so painful, it brought tears to my eyes. I lived up on the second floor and I had to drive 30 minutes to work. So I would do all of this physical manual labor, and then I would get in the car, and I was so stiff and swollen by the time I got home that it took me about 10 to 15 minutes to get out of the car. And I was like huffing and puffing and talking to myself. And then I would barely make it across the parking lot and stand there at the bottom of the stairs looking up, and it felt and looked like Mount Everest to me because every time I looked up, I just wasn't even sure how I was going to make it up the stairs to get up to my apartment. And once I did, and I had my days off, I just didn't go anywhere. The breaking point for me was my feet hurt so bad because I had swelling in my hands and my feet. I had joint aches and pains. I couldn't function. I had the brain fog. I had the fatigue. I couldn't focus. I couldn't concentrate. And the pain was just getting worse and worse. Anyways, I had 2 days off together and my feet hurt so bad that I spent 2 days scooting around on my butt in my apartment because I couldn't even walk on my feet. And I was just kind of trained to like suck it up. Like you don't go to the doctor, you just kind of handle it. And I remember he kept trying to get me to go to the doctor and trying to get me to go. And I remember turning to him at one point and saying, "Hey, do you think this is bad? Do you think I should go to the doctor?"
You can't walk, and you ask the question, "Oh, do you think this is bad? I can't do a basic function. Maybe it's fine."
Yeah. And he looked at me. And so, look, I'm autistic and I miss social cues, right? And sometimes I miss sarcasm and stuff like that. But I didn't miss this. Like, he stood there and stared at me. "Yeah, you think? You can't even walk. You've got to go to the doctor." And he was so relieved because I'm really, really stubborn and I really kind of don't listen to people.
But how did you think to even go to a rheumatologist? Is that where you started? I can't imagine, like you said, oh, this could be rheumatoid arthritis. How did you even get to that point?
No, I didn't even think that at all. Like, that wasn't even on my radar because, like, a week or so before that, I had dropped a crate of eggs on my left foot, and I had been really hobbling more so than normal around. And that was kind of an extra incentive to go to the doctor. So, genuinely, in my head, here's what I thought was going to happen. I was going to go to the doctor. He was going to look at it and say, oh, you bruised it or whatever. Maybe give me something to wrap it up. Maybe something stronger than what I could get over the counter. Maybe tell my work that I had to take some time off. I don't know. Something like that so that I could actually rest it. And then I would go back to work or maybe he'd figure out something that I just didn't know, but I'd easily get fixed and I would be okay. It still didn't occur to me that there was genuinely something really very wrong with me. So rheumatology and rheumatoid arthritis were not even on my horizon. I had no idea. When I went to the doctor, I went to my PCP and he was like on top of it. He absolutely automatically was the first thing he suspected. I presented equally on both sides, but my problem was the same problem that I've always had is I presented with the symptoms, but no definitive tests.
Oh, like the blood work?
Yeah.
Yeah.
Inflammation does not show up in my blood work. It never has. My RA factor was borderline. It just wasn't really there. And he could look at me and touch my joints. They were like red and swollen. I presented evenly on both sides of my body. I struggled. I was stiff and swollen, and it took me a while to get going when I got up in the morning. And then when I laid down at night, that pain that hits you at night.
Yeah.
After you stop. I mean, I had all of that, but x-rays were negative. The RA factor was negative. The inflammation levels were normal in my blood work. Like none of it was there. So he couldn't diagnose me or do anything with it. He straight up told me, I think you have rheumatoid arthritis, but I can't diagnose you with what I have. I have to send you to a rheumatologist. So I said, okay. I still was thinking, okay, fine, this is just no big deal, and still don't know why. I didn't think it was not a big deal.
So you got to the rheumatologist and then they gave you the rheumatoid arthritis diagnosis?
Yeah, well, I ended up going to the doctor and she ended up running the same tests. It was like standard procedure, I guess. And so then she still didn't get the diagnosis. So she ended up diagnosing me with an MRI of my left foot.
Wow.
Yeah.
And that's where she said that's rheumatoid arthritis?
Yeah, because she took all of my symptoms and she said, okay, look, I've done all of these tests. I can't definitively diagnose you with this. This is what we're going to do. You tell me where on your body it hurts the worst. And I did what I always did back then, because of course it was the worst back then. It was uncontrolled. I laughed.
You're like circling your entire body on the page saying this whole thing, that's what hurts. Yeah.
Yes. I hate when healthcare providers ask me that, especially when your body is not controlled. Where does it hurt the worst? And it was like uncontrollable. It was always uncontrollable for me. Like,
Yeah.
what do you mean where? But I decided on my left foot because I had dropped that crate of eggs on it. And so she did an MRI of my left foot. And so she pulled up the MRI and started showing me slide by slide and said, okay, we've got inflammation. And I had so much inflammation on my foot.
And what was that like for you to see that and actually say, like, wow, there is something wrong?
Honestly, I think I dissociated.
Yeah.
Because it went from being, oh, this is something that is an easy fix or short-term treatment to all of a sudden she was talking to me about steroids. And I knew this was a possible treatment, and what my PCP had said he thought was wrong with me. When I came to her and told her that, she said, I'm not going to commit to anything. I have to check you out. Well, being who I am, I analyze and prepare the hell out of myself for everything. So I had done research. I knew what kind of medication steroids were. I knew what kind of drugs and stuff were possible as a treatment for this. And so when she told me that, it was like the world stood still for me. I stopped hearing everything around me, and everything inside of me kind of shattered all at once, because this was permanent and it was long term. And I felt broken. And that's what it was. I felt broken, and I felt extremely overwhelmed.
Yeah, it's like you were feeling physically broken from all the pain, and then like the emotional gravity of it just came crashing down too, right?
Yeah. And that's worse than the physical part of it, the emotional side of it, because within a month, I had a panic attack. I ended up in the hospital thinking that I was having a stroke, but I was having a panic attack because I was so absolutely overwhelmed with all of the choices I was having to make, and not to go out of my way to like exercise.
Oh my
It was
gosh.
pretty scary in those early years.
And yeah, just thinking about, from the early years to like, I guess over the next few years, you would come to find the online community and really connect with other advocates and write and use art. Can you talk to us a little bit about what that part of your journey was like, just like meeting others with these conditions and expressing yourself through these different forms?
Well, I mean, overnight, my world got flipped upside down. I was taking naps in the middle of the day. I would work first shift and second shift from being a cashier, and I was going through things that no one around me understood. And I always struggled because I always look younger than what I am. I always have. And so at the time, even though I was 34, I looked like I was in my 20s. And so even if I looked like I was in my 30s, it didn't really matter because, number one, people never think that you're really sick.
Yeah.
Or that you're old enough that you should have anything be wrong with you. And so if you actually open up and tell people about what's wrong with you, because I had times where I had to use a cane. And I had times where I was so bad, I couldn't like step up on a curb. There was one period of time where I started doing things off of a bucket list because I was so bad. And my functionality was getting so bad. I thought I was going to end up in a wheelchair pretty soon. So I started doing things like going to Six Flags and doing all of this stuff that I didn't think that I was going to be able to do in a year, And so if I happened to open up and talk to people and tell people about what was going on with me, I always faced several reactions. And so I had to try to gauge people, which of course is hard when you're not good at reading faces.
And when you're just learning about this disease yourself, like you're still, like you said, figuring it all out and, what you can and can't do. And there's so much to learn about these diseases. And you're like responsible for learning that all yourself. And now you're saying you're also responsible for sharing that with other people. It's tremendously hard.
Yeah. And you can't do it all by yourself. If you're still working and you need help with something, like you need help reaching something or leaning over or whatever it is that you need help with, you have to open up a little bit because otherwise somebody's going to be like, why do you need help with that? You look able-bodied. You look like you should be able to do that. Like, what's wrong with you? And then they're going to just think that you're lazy or you're taking advantage of the people around you, which is the last thing that you need at work, right? And so then you have to deal with several reactions, right? Either, number one, people get so uncomfortable and they don't know how to talk to or deal with you because they don't know how to deal with your pain. And so they don't want to talk about it, or they skip over it, gloss over it, and like they would just rather just walk away from you and not deal with you, right? Or you have, I'm in the South, or you get a lot of your bless your heart, people who feel sorry for you.
Yeah.
And as someone who has been independent, extremely independent their whole life, the last thing I have ever wanted is for somebody to feel sorry for me. You never want somebody to feel sorry for you. You don't tell people because you want them to feel sorry for you. You just explain because, hey, this is why I need your help. And when you do this for me, it's a genuine need, and I really appreciate that you're doing it for me. That's it. A plus B equals C. That's all there is to it. And instead, you get people who feel so sorry for you, they can't think of you in any other way except for pity. And that's terrible.
Yeah.
They can't treat you like a normal person.
Yeah, you're like, I'm a person first, not a disease.
And you don't become anything but that disease. And then, like, anytime you're around them, oh, you poor thing. How are you feeling today? Are you okay? Oh, you poor little thing. Like, I've even had people go, oh, honey, are you doing okay? Did you know that in the early years, oh, did you know that she has, and then, like, I've had people tell my business, yeah, like, it's been bad before, you know?
Yeah.
And every once in a while, you'll have somebody who's just genuine and, like, you know, they'll truly be kind. They've had somebody in their family who's had an autoimmune, you know, someone who genuinely is trying to learn. You'll have somebody who's a good person. They're amazing, you know, and those are few and far between.
I know you've had a few more diagnoses in the last 2 years, and we talked a little bit about moving from patient to a zebra. Can you talk to me about like how you knew something was wrong and it wasn't just the rheumatoid arthritis? Like what made you think there could be something else going on here, and like how did you get to the point where you're getting these diagnoses?
Well, so I was first diagnosed with RA back in 2011, like at the end of September. And then in January, early January of 2012, I got diagnosed with fibromyalgia. That was my second diagnosis. But I don't ever remember not hurting that way. So I really just think the diagnosis came later. I think
Yeah.
they were pretty much simultaneous. And, of hypothyroidism, like all of this stuff. Well, I've actually gone back and looked at my artwork because I reached out to Creaky Joints back in 2015 because it was super lonely for me not having anybody around me. I started blogging for Creaky Joints, and it was a huge way for me to connect with other patients. And I started blogging about my experiences, and I started noticing symptoms that I was having. And my problem is, anytime I have symptoms, I have doctors who say to me, oh, well, that's just like your RA.
Yeah.
Or, oh, that's just this or that's just that. And they just chalk it up. Or my favorite one is, well, why do you want another diagnosis? The treatment is just still going to be the same as what you're doing right now. I literally can't tell you how many times I have been told that actually within the last 4 years.
That's crazy. Also, because we're studying new treatments. There could be a new treatment down the line that you need that ticket of a diagnosis to get it.
That's right. And having more than one autoimmune disease actually opens you up to complications, which is actually what I have. So I actually have small fiber polyneuropathy, which means polyneuropathy means I actually have it all over my body. So my small fibers have been demyelinating from the inflammation in my body. I have large fiber neuropathy as well, but it's not as advanced. And it has come from the inflammation in my body. And I actually wanted to spend time talking to you about this on the show because of several reasons. What I have is a very high risk. Most of the time, my neurologist, who I see a neuromuscular neurologist, not just a regular neurologist, it's those who have lupus and Sjogren's are the ones who have the highest risk of developing it, although you can develop it from rheumatoid arthritis. And I was most recently diagnosed with Sjogren's, and I had undiagnosed Sjogren's that went on for years because doctors didn't listen to me and didn't believe that there was anything wrong with me. I started having nerve symptoms that nobody would believe that there was anything wrong with me. And so small fiber neuropathy has all kinds of symptoms and it crosses over with fibromyalgia. And it is believed that up to 40% of the people who are diagnosed with fibromyalgia actually have small fiber neuropathy. But there's not enough information out there, and not enough doctors are trained and have enough knowledge about small fiber neuropathy. So small fiber neuropathy is a nerve disease, and they call it like the sock and glove, because you'll feel it in glove and sock formation, right? Like you're wearing gloves and socks. Started very much so with burning in my feet. And I got to the point where I now, even in the dead of winter, like I can almost never wear socks. And it doesn't matter how cold it is, because the burning pain in my feet is so bad. I can't tolerate anything on the tops of my feet. So any kind of shoes that I have, they have to have, like, it's open on the top, and I can only wear them for like maybe 2 hours at the most. And I can't tolerate anything tight on my skin. If I do, it'll start to cause pain flare in my skin. And that's where it is the allodynia. So a lot of fibro patients will know about this, right? It's the skin pain, and it'll cause it all over my body. And so in 2014, 2015, one of my pieces of artwork that I did shows that I had it, and I didn't know that I had it. I drew this piece of artwork because I went to a job interview. I went outside. I went to step down off the stairs and I missed a step. I stepped down, my ankle rolled, and I fell and I landed with my foot underneath me. I got up, I walked, and then I went back to work, and my ankle and leg started to swell up. Now, I was concerned with breaking something, right? Because if you have to have surgery, you have to come off of your medication. And it's a big deal for me because my body overcomes medication like very easily. And surgery is a huge fear of mine because of having to come off of medication and stuff. And so I went to the ER to try to get an x-ray and make sure everything was okay. I was in so much pain. So much pain. Of course, they treated me like a drug seeker. I was really mad. And I told them, I don't want your drugs. Can you just freaking x-ray my leg? And then they calmed down. So they x-rayed it, said nothing was wrong, but they gave me a boot. And it went, of course, from my toes all the way up my calf, up to my knee. And they said I needed to wear it for like 4 days to support my ankle and my leg to give it strength and make sure I was okay. And I had to wear it tight.
And that set off your symptoms of the SFN?
Yes. And the tightness started to squeeze, and it started to set off an all over nerve flare in my body. And the longest I could tolerate it was 3 days. By the third day, I kid you not, I was swearing at my partner. I was ready to punch everybody who was near me, and I had to take it off. And like, he was like, you can't take this off. The nurses, the doctors, the hospital said you have to wear this for 4 days. And I said, like, through gritted teeth. And I was like, you do not understand me. If I keep this on, I'm going to stab you with something sharp. You have no idea how much pain this is in. And the next 24 hours, I had electrical shooting pain through my foot and all the way up my leg.
Oh my gosh.
And that's the nerve pain that I was having.
And it took how many years later until you actually got the diagnosis?
Well, it took me 7 years to get my diagnosis. The only person who believed me and pushed me and kept sending me back to my regular neurologist to get tested was my nurse practitioner at my pain management doctor. I kept telling her about my symptoms and they kept getting worse. And the whole diagnosis of rheumatoid is a symptom. My heart arrhythmia, I have a form of dysautonomia called IST, and I have SVT. Both of those are a symptom of my small fiber polyneuropathy.
It's like all of the puzzle pieces just came together.
Yeah, they did. I mean, I had to wear a Holter monitor for like a month. My heart would race and race. I have so many specialists at this point. And I would talk to other people. It started with talking to other patients, asking them if they were having these problems. Nobody else was having this burning pain, but mine wasn't limited. I have these random numb spots all over my body. Like when my neurologist, when I go in to see her, she will have me like turn away and not look, and she'll break like a tongue depressor or like something else where it'll have kind of like a point on it. I'll turn, and it kind of scares me sometimes because she'll use the pointy spot to kind of press in different parts of my body, and I will be able to feel it. And then 2 inches later on my body, I won't feel it at all.
So scary, yeah.
Yeah, that part of me is totally numb.
You know, I'm noticing the time. I feel like we could talk about your story for hours and hours, but I'm wondering if maybe you could leave us with what's your advice for other patients who, similar to you, have symptoms that are unanswered. Like, what's your advice now, having gone through this journey, potentially more journey to go through? What would you tell other patients?
Okay, yeah, so I have several things. Number one, get a physical copy of your medical records. Keep that on hand with you. Number two, keep a physical record of your symptoms, okay? Don't try to remember it because you won't, right? We have good and bad days. So don't put that onus on yourself. Just don't stress yourself out like that. Keep that record on you, okay? Try to keep like dates and all that kind of stuff. But even if you can't keep that, just write down your symptoms and keep a running tally of your symptoms. Okay? That really, really helps. And number three, find that one good friend who is always going to bolster you up when you get discouraged, and who's going to always have your back, and who's going to support you and say, I believe you, and there's nothing wrong with you saying these things because you know your own body. Just because a test says there's nothing wrong doesn't mean there's nothing wrong with you. We are our own best advocates, and we have to live with our bodies. It's us, and the doctors don't live with this, we do. So don't give up. Just don't give up.
Oh, I just got the chills. It's so true. It's like having the mental courage to keep seeking answers is so hard, and having just one person believe in you can make such a difference.
Yeah.
Thank you so much for joining and sharing your story. Yeah, I really appreciate it, and all the wisdom for our audience. Thank you, Jae.
No, of course, it's my pleasure.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.